He had failed 17 medications. He was hearing voices, and then he stopped eating carbs. What happened next shattered everything I thought I knew about medicine. Hi, I'm Marc Bates. I'm a metabolic health coach. This is part of my question and answer series, and it's titled The Moment I Realized Medicine Was Treating the Wrong Disease. So here's the question. Most doctors spend years learning to prescribe medications for symptoms, yet you're suggesting they're missing something fundamental about disease reversal. What was the specific moment you realized conventional medicine was treating the wrong thing? Okay. A powerful example of a specific moment when a medical professional realized that conventional medicine was treating the wrong thing comes from Dr. Christopher Palmer. It's a handsome man in the slide. He's the author of Brain Energy, a book I highly recommend and I quote often. He recounts a pivotal experience in 2016 when a patient named Tom, who had been tormented by schizoaffective disorder for over 13 years and failed 17 medications. Palmer helped Tom lose weight using a ketogenic diet. He put him on the diet only to help him lose some weight. The patient asked him to help lose some weight, so he was only expecting these physical benefits, but instead witnessed an astonishing reversal of psychiatric symptoms. Within weeks, he began making more eye contact. After 2 months, he told me that his long-standing hallucinations were receding. He began to realize that they weren't true and probably never had been. It was an eye-opening moment for Dr. Palmer. This dramatic outcome forced Palmer to reevaluate everything he thought he knew about mental illness and catalyzed the development of his metabolic theory of brain health. He writes, I had never seen anything like this. Nothing in my knowledge or experience suggested that the ketogenic diet would treat his symptoms. That all changed for me in 2016. But it gets better. Similarly, registered dietitian Michelle Hurn, who wrote the book The Dietitian's Dilemma, another book I quote from often, describes her own breaking point after years of working in a hospital setting, watching patients religiously follow dietary guidelines, low-fat, high-carb, plant-based, and yet remain sick or grow worse. If health could be restored quickly with minimal to zero side effects, could I continue to practice in a system that refused to allow me to teach this potentially life-saving information? I had a dilemma and a choice to make. In both of these cases, the moment of realization was deeply personal, professionally jarring, and led to a radical shift in understanding the reversing of chronic diseases may require challenging the fundamental assumptions of modern dietary and pharmaceutical paradigms. So, are you ready to be on your own journey for this? Thanks for watching. If you have any comments or questions, put them in the appropriate section. If you have something you want me to cover in an upcoming video, let me know. I'll get to work on it right away if possible. And if you haven't done so, please like, subscribe, and share the video. It does help the channel a great deal. Thank you.